So welcome everybody. Thank you so much for joining us. I know I called out a few of you a few minutes ago, just trying to figure out how everybody heard about this and know what's working. Um, but you are probably all here to learn how to save some money on your healthcare. So today's presentation is Stay Healthy, Not Broke, How to Hack Your Healthcare. So I'm Dr. Tania Velez, and I will be doing your presentation tonight. I'll save some time at the end to do a question and answer session. This is a huge topic. So I tried to get at least the basics in here to give you a good overview. And then in the question and answer session, if you have any questions, then we could kind of go a little bit deeper into certain things. And I'm sure others will have some of the same questions that you may have. So, feel free to ask questions at the end. I will open up, or the chat box will be open. So if you think of things along the way, you could put them in there. I can't see it until later, but you could put them in there if you think you might forget. All right, and then I'm going to ask for everybody to put your microphones on mute as well for now, and then we could open it up. I'll have some questions for you guys, and we could open it up at that time. All right, so you're here today because you are confused with our healthcare system, along with the rest of us. And this is kind of what it looks like. It's a big, complicated maze. And like I said, this is a really big topic. So we're just gonna give you some of the basics today, and then we could explore a little bit deeper in the question and answer session. And then you could do a little bit of more research on your own, but hopefully this gives you a good foundation to kind of get started. Some of our objectives today will be to look at healthcare costs here in the United States versus the outcomes, how insurances work, some of the insurance lingo, and health insurance alternatives, so some other options that you could choose from, and how direct primary care saves you money and provides better care. And then at the end, we'll have a question and answer session to go over some more details. So for those of you that don't know me, again, I'm Dr. Tania Velez. I am the founder of Velez Family Health, which is a direct primary care practice. And as it pertains to this topic, I have many years experience in medical billing, medical records, which used to be my old jobs, from my first job back in the day. I was an EMT for a while, then later residency, and now an attending physician. I went to undergrad at UCF and Valencia and Seminole College, then went to medical school at USF and did my fellowship in integrative medicine over at University of Arizona. I went to the Florida Hospital Family Medicine residency, now called Advent Health. And so my vision is to provide the best care in a vulnerable situation and advocacy for our patients, and to really promote healthcare equity, which is the reason why I'm doing this presentation tonight, to make sure that everyone is able to get the care that they deserve. So let's talk a little bit about healthcare expenditures here in the US. So in the United States in 2020, healthcare costs per person averaged about $11,000, which is about twice the average of other wealthy countries, and the average being about $5,496. The US, however, spends the most on administrative costs, but the least on long-term care compared to other wealthy countries. The US is almost 9 times the average for administrative costs. In 2018, the US spent $3.6 trillion on healthcare, again, averaging about $11,000 per person. And if you look at how healthcare costs have grown or have increased, way back in 1960, it was only 5% of gross domestic product. In 2018, we were at 18% of gross domestic product. And by 2028 is predicted to be at least 20% of gross domestic product. And prices for medical care are actually growing faster than inflation. So financial concerns due to healthcare costs are serious. So the figure on the left shows the percentage of people that were concerned about a major health event leading to bankruptcy in both 2019 and in 2020, and it's broken down by age. The figure on the right shows the percentage of workers with an employer-sponsored healthcare insurance that reported that they still had difficulty paying medical costs as of 2018, with 40% of them having some kind of affordability problem. And this is with employer-sponsored health insurance already. So why are prices going up? So some reasons for the prices going up is new technology. So new technology obviously will increase the cost of procedures and products. The complexity of the system can lead to administrative waste. As I mentioned before, we spend the most on administrative costs. Consolidation of hospitals lead to less competition, and in some cases, hospital monopolies. You could think of here locally, a couple of the hospitals that seem to own a lot of practices and a lot of different places. Third-party interference, such as health insurance, and the fact that there is no price transparency. So we spend all this money on healthcare, so that means that our outcomes should be pretty good, right? Unfortunately, that is not the case. So although the US spends more on healthcare than any of the other developed countries, we're actually not ranking so well in outcome metrics. The only one here on the left that we're doing fairly well with is heart attack mortality. On the right, it shows life expectancy. So our life expectancy is actually the least, so is that bottom line there, and is at 78.6, so it's the lowest of any of the wealthy nations. So why is this? We're spending all this money on healthcare, and yet we have the worst outcomes. Compared to other peer nations, the US has the highest number of hospitalizations from preventable diseases and the highest rate of avoidable deaths. Now this graph is from 2016. I expect that if you probably pulled up 2020 and 2021, it would look probably about the same. Numbers will probably be a little bit worse. So this slide is blurry and it's meant to not be understood because this is actually a representation of our healthcare system. And it's what's called a fee-for-service system. So when I first started my practice, I started my practice back in 2015. We were part of the fee-for-service system. And what this means is that you're paid by each service that you provide. You follow insurance regulators and government guidelines. You have to submit data, do a bunch of paperwork, fight to get paid. The insurances deny your pay, underpay, and they create such a complex system that not only does it drive up costs, but it also promotes a system that's based on volume versus time with the patient. So it's promoting sick care versus well care, and it promotes keeping people sick rather than getting them healthy. Providers are paid to do things to patients rather than actually care for patients. I was not happy in this model, and the majority of my patients were not happy either. So we decided to make a radical change to what's called the direct primary care model, which we started January of this year. So our healthcare system is not broken. I know that sounds weird, but is actually working exactly how it was designed to work. Healthcare is a $3.3 trillion industry. The healthcare industry in 2020 spent $623 million in lobbying Congress. So let that sink in for a second. $623 million was spent on lobbying Congress. That's more than any other industry in the country. So in the conventional medicine or the fee-for-service medicine system, there's middlemen. These middlemen are the ones that honestly are the ones that are making money off of your sickness. They're the ones that set the regulations, the amount of paperwork, the amount of click boxes that we need to click on. And honestly, they typically usually don't know a whole lot about medicine. So this is how our conventional system works. So you have the doctor, the administrator, the insurance, the regulator, and then the patient. In direct primary care, it's a direct relationship between the doctor and the patient without those middlemen. So unfortunately, all of this leads to victims of the system. So as patients, being a patient myself, we have to put up with long waits, lack of access, high bills, surprise bills, and unfortunately, sometimes even bad care because providers are burned out. So this volume-based care, it leads to burnout. Greater than 50% of the provider's time is spent on paperwork and not actually seeing patients. Insurances dictate treatment, and because of that, there's very low compliance because we just don't have enough time to, or in that system, we didn't have enough time to really educate patients. So we just covered how expensive healthcare is and why, but the real question is now, is insurance actually necessary? Well, that kind of depends. I always recommend to have something as a safety net because, as you saw, healthcare is expensive, or it can be expensive if you in certain situations. So really what you need to do is be educated on how the system works so that you can make it work for you and be able to choose the most cost-effective solutions. So whether you choose to have an insurance, a health share, and I always recommend a direct primary care doctor, but knowing how the system works, you can make it work in your favor. So that's what really this presentation is going to be about. So let's go a little bit over car insurance. So car insurance, covers catastrophic care. Your car insurance does not cover oil changes, tire changes, your regular routine maintenance and repairs. If it did, imagine how expensive your car insurance would be. Prices would skyrocket. So why is our health insurance set up this way? The administrative cost to be able to file a claim for every single little thing drives up costs. The more quote unquote coverage that we have, the higher the cost, because the higher the amount of administrative costs and to file each one of those claims. Unfortunately, coverage does not equal care. So let's talk a little bit about how insurance rates are determined. Insurance companies, like I said, are middlemen. So they have to promise savings. So let's think about an analogy. So have you ever seen a department store that always has a sale? Not sure how they could ever be profitable because there's always a sale. Well, they could do this because they bring up their baseline. So they mark up the cost and then they give you a discount from this cost. And this is actually exactly how insurances work. So they have to report back to an employer or a government agency and tell them how much money have they saved them. So the hospital, the imaging center, the corporate medical practice, they mark up their rates and then they offer a discounted rate to the insurance company, or what's called the allowable rate. As big corporate practices like hospitals are, they could actually negotiate these rates to be much higher. So hospitals and big corporate agencies, they actually are probably get paid around 115 to 200% of Medicare rates. Everything's kind of based on Medicare rates. Where little solo practices like me, we were paid about 75 to 85% of Medicare rates. So now the insurance company can go back to the employer or whatever government agency that they work for and say, look, they usually charge X for this procedure. We paid Y, and look, we saved all of this money. But what is the real cost of this procedure or imaging test or whatever it was? So now you learn how some of the insurance rates are determined. So if you decide to have insurance, where do you start looking? So some of the places where you could look is employers. So some employers will offer insurances. The employer chooses and creates that benefit package. The marketplace or healthcare.gov. So these insurances sometimes offer a subsidy based on your income. And they are what's called Affordable Care Act approved most of the time. So with the Affordable Care Act, that means that they will cover pre-existing conditions as well as preventive care. There's individual plans, so you could go to different individual insurances like Cigna, United Health, et cetera, and purchase insurance. A lot of these you have to purchase riders for pre-existing conditions, and a lot of them do not cover preventive care. Then there's short-term insurance plans. These plans could be purchased as little as a month at a time, all the way up to 364 days. And with the renewals, they could go all the way up to 36 months. Most of these are not Affordable Care Act approved. So these don't usually cover things like pre-existing conditions, preventive care, maternity. So these are what we call truly a catastrophic care. So if you end up in the hospital, there's a true emergency. Now we're going to get into the nitty gritty, and this is where it gets a little boring. So I hope you stay with me. There's a lot of info in the next 2 slides. So when you are looking for insurance, you have to know what all these terms mean so that you could make the best decision for yourself. So let's talk about the 3 main types of insurances. First one is an HMO, which stands for a health maintenance organization. So with an HMO, these premiums are usually a little bit lower, but you have to stay in network. So they have a network of providers that take this insurance, and you have to stay within that network. And you typically need what's called prior authorization or a referral for almost everything. So to see a specialist for certain imaging tests, etc. A PPO is a preferred provider organization. These premiums typically are a little bit higher, but you're getting more flexibility. So you don't need referrals, you don't need prior authorization from the insurance to see a specialist and things like that. These typically have what's called a deductible, which I'll explain in the next slide. And a lot of times these will cover some out-of-network doctors. So if you find a doctor you really like that they're not in network with this insurance, they'll still cover a certain percentage. The last type is called an EPO, or an exclusive provider organization, which is kind of like a hybrid between the HMO and the PPO. The premium is somewhere in between. So you have that same flexibility of not having a referral, but you have to stay within their network. So little caveats, especially when you're looking at the marketplace, healthcare.gov, you have to think about their network. So some of these insurance companies, you'll read the benefits, they sound amazing, but then when you go and try to use it, you can't find a provider that's actually in your network. So some of the insurances like Ambetter, Bright Health, Oscar, they tend to be exclusive to a certain hospital, for instance, like Advent Health. So you have to stay within that network. And as long as you're okay with that, that's cool. But these are things that you have to think about and make sure that the providers that you want to see are within that network. So when you're looking at insurance, some of the things that you want to look at is these terms here. So each insurance will have a little graph explaining each of these little things and what it is for that particular plan. And it's going to vary based on each individual plan underneath the umbrella. So Blue Cross Blue Shield, for instance, will have multiple plans underneath it. So a premium is what you pay per month. A copayment is what you pay per visit, per procedure, for a medication. A deductible is the amount of money that you have to spend before the insurance will kick in. So let's say you have a $8,000 deductible, you have to pay $8,000 out of your pocket before the insurance will actually start to pay for things. A co-insurance is the percentage you have to pay after you meet your deductible. So some insurances will say something like office visits 20% co-insurance. So once you meet your deductible, then you pay 20% of whatever that visit costs each time you go. Out-of-pocket maximum is the maximum that you'll pay out of pocket before the insurance will cover at 100%. So let's say you had a really rough year, you were hospitalized, you had all these things that you ended up paying out of pocket. Once you reach this maximum, then from then on, the insurance will cover things at 100%, regardless what your co-insurance is, co-payment, etc. And a referral, I mentioned previously, is basically a prior authorization from your insurance for specialist. And that's obtained by your in-network primary care doctor. So if you don't have an in-network primary care doctor, they cannot get this prior authorization for you. Again, you got to make sure you stay within your network. So when you're looking through the marketplace, I actually went through there several times making this presentation. And what I found really interesting is they have these charts where it says, your premium, your copayment, et cetera, et cetera. And they love to use the word free. So it'll say something like office visit, free, imaging studies, free at in-network diagnostic or something like that. Just remember, free is a horrible word for them to use. Nothing is free in life. You're paying for that. So it should say covered or included. So just make sure you're thinking about the total cost and not just kind of falling for the whole free. You paid your premium. It's not actually free. And another thing with this is, remember how I mentioned before what's called the allowable fee. So what the insurance contract states will be what they pay for a certain thing. So let's say, for instance, the insurance contract with my practice pays me $75 for an office visit. So if the patient is paying that, let's say as part of their deductible, that is the amount that they're going to be paying. And we'll get into this later, but a lot of times that allowable amount is going to be much higher than actually not using insurance. And I'll explain that. Health savings account. This is an awesome account. So a health savings account is a great product to look at, especially if you do qualify for any subsidies from the marketplace. Because if you do, you might be able to snatch a high deductible plan that qualifies for an HSA at a pretty good premium. And the cool thing is that HSA gives you triple tax savings. So you'll get, say, for instance, a plan that qualifies that has a $5,000 deductible, but then you could get this HSA. So the HSA, you could put money into it without being taxed. So it's pre-tax money. The money that grows in this account, if you invest it within the HSA, is tax-free. So you don't have to pay taxes on any growth in the investment. And you're also not taxed when you take the money out, as long as it's for qualified medical expenses. The other really cool thing is that it could be used for retirement. So after the age of 65, the penalty that they have to withdraw for non-medical expenses, which is usually about 20%, that actually goes away. So after the age of 65, you could actually withdraw the money for non-medical purposes. And it's actually taxed the same as if it was an IRA. And then you could use this money after retirement, or you could keep it for medical expenses, which typically increase after the age of 65. Another cool thing is you could choose not to use your HSA when medical things come up. You could pay it out of pocket and save your receipts. You can reimburse yourself at any point for any qualified medical expenses. So let's say, for instance, now I go have all these tests done, I save all of my receipts. 2 years down the line, I want to go on a cruise. I want to use that money so I could reimburse myself for all these medical expenses that I've already paid for, as long as I have the receipts matching the amount that I'm taking out. So let's say you're like me and you've looked at all these insurance options and they're crazy expensive for you. So there are some alternatives to health insurance, and one of them is a health share, which is actually what I have. So a health share is an alternative. It's basically a community of members with like-minded ideals that share in each other's health costs. So the way I think about it is basically everybody puts money in a pot, and as qualified medical expenses come up, things are paid out of this pot of money. And this is typically a lot more cost effective than insurance. It is not regulated by the insurance legislation, so we do have to be a little bit careful. There's been a couple companies that have not done the things that they're supposed to be doing. So the ones that I listed here are ones that are very reputable, and I either have myself or have friends or patients that have these. Um, the cool thing about this is that you're considered self-pay. So as a self-pay person, when you go have a medical procedure, you typically could negotiate better prices. Um, if it's planned in advance, a lot of times the health share will help you negotiate these prices for surgeries and things like that, and you typically spend a lot less. And lastly is supplemental insurances or indemnity plans, which I can't say, hence the llama there. But I'm not going to go too much into this because this goes on a whole other tangent. But these are things like Aflac, Colonial Life. You've probably seen commercials about these. And basically, they pay a fixed amount per occurrence. It is not insurance, but they'll pay you a certain amount for certain things. So if you're in the hospital, they pay you this much per every day that you're in the hospital. It's paid directly to you. There's no network. And so it helps cover some of these out-of-pocket costs. And there's all different kinds of different policies and whatnot. So I've mentioned direct primary care several times. So that's going to be the next part. So what is direct primary care? For those of you that are part of my practice now, hi, thank you. You guys are awesome. But basically, direct primary care is affordable, accessible, comprehensive primary care. You get care provided at a flat monthly fee versus per visit, like the fee-for-service system. You have a direct relationship with your doctor. There's no third-party intrusion, and we could focus more on wellness rather than sick care. So with direct primary care, it has been shown in multiple studies to have better outcomes, lower costs, price transparency, improved patient experience, much more timely care and access. My members have my cell phone number. They could text me, they could email me. And for acute things, we either talk to them or see them same day or the next day. So there's a focus on wellness. And again, you have this personal relationship with your doctor. As part of our membership plans, we include all of these things. Unrushed 30 to 60-minute visits, which are very different to my fee-for-service practice. We have a much bigger focus on lifestyle and wellness, same day or next day care for acute issues. We could do televideo, text, email, phone. It doesn't really matter because we don't have a third party telling us how we have to do things. It also includes any in-office testing like EKG, urine test, pregnancy test, coordination of care with the specialist. I have several specialists that I speak to almost on a daily basis, and I could text them and make sure that our patients are taken care of. We have directly contracted prices with the labs, with imaging companies, as well as discounted pricing for supplements. We run a few different lifestyle programs here, so our members get discounted rates. And best of all, there's no surprise billing, and there's always transparent upfront pricing. So let's run through a few little cases here so I could kind of show you the difference in when to pay direct, how insurances would work, etc. So let's do an abdominal pain case. So this is a 54-year-old woman that's been having some mild abdominal pain for about a week or so. Is progressively increasing. Today the pain got worse. It's focused now on the lower left side. She's got some nausea. So this isn't a real case. So she called me on a Monday morning. I saw her on the same day. I actually sent her to get a CT. And we got the diagnosis, started her on antibiotics. But let's say she's in the fee-for-service system. She calls her doctor's office, and they say, we can't see you for another 3 weeks. So she's like, okay, well, I got to go to the ER. So she goes to the ER. And so an ER visit, I put greater than 5,000 just as an average, because honestly, I have no idea because it varies all over the place depending on the hospital. Um, but let's say she goes to the ER, she gets charged, something around $5,000. And they tell her, okay, you have diverticulitis, you need to go follow up with a gastroenterologist. So then she has to go there. Her first office visit as a new patient is around $250. Her follow-up visit is around $180. She got a CT scan done in the ER, which is included in that price, but those usually range somewhere between $3,000 to $8,000 inside of the hospital. And she got some antibiotics, but she's smart. She used GoodRx and she was able to get her antibiotics for 23 bucks. So total cost somewhere around 5,453 bucks. Now, this other person, she's a member of our practice. So the likelihood that she would need to go to an ER is much less. Her office visit was included. Her follow-up visit was included. We got her in same day at an outpatient imaging center for $300 for a CT scan. And we used GoodRx for those antibiotics. So her total cost was around $323 for this acute thing. So she saved over $5,000, probably more, to be honest. So these savings would pay for her entire year's membership with us and then some. She could go on a vacation or a cruise with that money, have some fun. So paying direct saves you money, whether that's through us in direct primary care or in general. What makes it much easier with us, obviously, is we do the legwork, so we know exactly where everything, what the prices are. So as you can see here, office visits, televideo visits, that's all included in our pricing. Procedures are all included in our pricing. And chest x-ray, 25 bucks, even an MRI, $300 without the hassle of having to wait for prior authorization from the insurance and whatnot. But again, direct primary care decreases the likelihood that you'll need an urgent care or an ER, which is going to save a lot of money just right there. So I put these here as just kind of an info, because I mentioned before that some of the insurances will cover preventive care. So I was looking at insurance for myself, and the prices were crazy. The cheapest that I found was about $400 a month with a $8,700 deductible. So basically all it was going to cover is preventive care, because there's no way I'm going to reach that deductible. So I'd be paying $400 a month basically just to cover preventive care. Depending on your age, paying your preventive care out of pocket might save you a whole lot of money. All right, so here's where we get a little interactive. So I want you guys to, you could turn on your microphones if you like. And so this is a bill. So this patient asked his doctor to do a PSA, which is a blood test, prostate specific antigen screening for prostate cancer. Unfortunately, he has Medicare and he had already done this. So the insurance didn't want to cover it. So they were saying that the estimated cost was about $201. So I'll give you guys a guess. How much do you think this test actually costs? Self-pay, direct pay. Anybody want to guess? I can't see you, so you got to turn on your microphone.
How about 50 bucks?
A lot lower.
Really?
Yeah. Anybody else?
20.
One
I feel
more.
like the price
lower.
is right.
Lower.
Lower than 20 bucks?
Lower. Yeah.
Oh, 15.
All right, you're getting colder. I mean, warmer. So our cash price, $5.
$5?
$5. Yes. So this is just one example. So, if people have insurance, they want to use their insurance, obviously, you're paying a good hefty premium for it. But if the insurance chooses not to cover something, again, you're going to be paying what their contracted rate is. So for this specific test, the Medicare contracted rate was $201. Our cash price, $5. That's a huge difference.
Absolutely.
So this next one, so this is actually a real bill. This is actually my bill. I redacted a few things so I don't throw this lab under the bus because they're an amazing lab and I love them. So I don't want to tell on them. But as you can see there, the total price was $1,634 for this. I definitely did not pay that. I'll give you guys a couple guesses on how much I actually paid. Anybody?
Okay, I'm gonna guess super low, like $25, because you've been going so low.
I wish. I really wish for this one, but no, not that low.
Okay.
What kind of test was it? I didn't hear.
I didn't say because I didn't want to throw the lab under the bus, but it's let's just say it's
a blood work lab.
It's blood work. Yes,
okay.
Rheumatology labs.
Okay. $50.
All right, we're gonna go a little bit higher, a little bit higher. One more.
$250.
We're somewhere in between. $150 is what I paid. So $150 for this. It's an amazing panel. I love this test. But yeah, what they would have sent to the insurance would have been $1,634. Now that might not be what the insurance would have paid them because again, it goes by the allowable amount. But yeah, this is a huge difference. I wouldn't have had it done if it was the first price. Knowing that it was this price, only $150, then it's definitely worth it.
Wow.
Yeah. So how to save on healthcare. This is why you guys came here, right? So number one is being knowledgeable. So having that knowledge of how does insurance work and kind of understanding that the insurance price, if you end up having to pay for it, is always going to be, almost always going to be higher than the self-pay price. So in that case, you always want to ask what the cash pay price is. And not every place is going to tell you because again, there's not price transparency, and especially with the bigger networks or bigger hospitals, they're probably not going to tell you up front, but you could always ask. One of the things that a lot of these places will say is, well, you have insurance, legally you have to use your insurance. That's actually not true. There's a law called high-tech law, which requires that any HIPAA covered entity offer a cash price to their patients if they do not want their insurance company to get any information about that visit. So it's actually built more as a privacy law. So if there was something, kind of confidential that you didn't want, let's say your spouse to know about that gets all the insurance stuff, you could choose to not have that visit sent to the insurance company. You pay out of pocket, and in return, they're not allowed to send any of that information to your insurance company. Obviously, that causes way more paperwork for them, trying to keep all of that straight, like which visit was, which visit wasn't. So they don't want to do it. But you're in your rights to ask for a cash pay price. The other thing is price shop. That's exactly what we do. We do the price shopping for you, basically. So for instance, for imaging companies, I have talked to or negotiated with every imaging company that I have come across. And the ones that actually are transparent with their pricing are the ones that we use. Because I could tell you up front, here's an MRI, you could get it done at this place, it's $300. And if they don't want to give us a cash price, then we don't deal with them. For prescriptions, you could use savings cards. There's multiple out there. GoodRx is probably the most popular and the one that we typically use. But sometimes even with insurance, your copay for a medication, let's say, is $25. And if you look on GoodRx, you might find it say for $9. So you could actually save some money on medications by not going through your insurance. Next is anticipate your needs. So prepare for the worst. And live a healthy lifestyle. That's going to be the probably the number one right there. You know, because if you don't need to go, then you save even more money. So some of the combinations that I like the best is always starts with direct primary care, of course, but a direct primary care with a high deductible plan and that HSA, again, especially if you're getting a subsidy for that high deductible plan, that is probably the best one to go with if that's financially feasible for you. A direct primary care with a health share. Again, health shares are not insurance, but it helps to cover a lot of those medical costs. That's actually what I'm using right now. I have direct primary care and Zion Healthcare or health share, sorry. Or at least have a savings account, you know, some kind of a savings, some kind of a safety net for those unexpected things, because we could be the healthiest people in the world, but things happen, accidents happen, illnesses happen. So you want to make sure you have that safety net. If any of you own a small business, you know, being a small business owner myself, it is difficult to be able to afford to give your employees medical care. It really is. It's expensive. So direct primary care is a really good cost-effective solution to give to your employers, or excuse me, employees. And it's a great way to save money on medical costs, but also, you know, give them really good care. It shows them that you care. It keeps your staff at peak performance. It decreases absenteeism, and it also decreases the cost burden of chronic disease. And with small businesses, you could kind of do same type of combos that we talked about previously. You could, you know, if you don't have the means to offer a whole lot, at least just a membership to a direct primary care practice. If you do have the means to offer a little bit more, Sedera and Zion Health Shares offer business plans, so that they create a wraparound with direct primary care. For individuals and for businesses, both of those actually offer a discount if you're part of a direct primary care practice, because they know that they're not going to have to pay out as much because you're going to get very good care. And again, you can always do also the high deductible plan with or without an HSA as a business owner as well. So if you're not a member of our practice and you're kind of wondering, well, how much would something like this cost me? These are our current pricing right here. So we go on an age-based scale because unfortunately, as we get older, we require a little higher care. So this is actually what we charge currently. And if you'd like to sign up, you could visit our website, it's velezfamilyhealth.com. I schedule a meet and greet with all of our new patients so that you could ask questions, you know, kind of get to know me and just make sure that it's a good fit for you. All right, question and answer time. Let me get out of this so I can see people's faces. Here we go. So any questions?
Well, I have one regarding trauma.
Mm-hmm.
So the cost would be prohibitive if you didn't have insurance. So if it was a car accident, God forbid, you wouldn't be involved. So what would help if we didn't have our regular Blue Cross Blue Shield that we were paying stupidly abnormal fees?
Yeah.
What would you suggest for things like that? Because I'm relatively healthy. I'm not worried about that. I'm more worried about that.
Right. Yeah, the big bills, the hospital bills.
Big, yes, yes.
Yeah. So that's why I say that I recommend something. Now figuring out what that something is looks like for you is going to be a little different than what it looks like for somebody else.
Right.
So if you're relatively healthy, I would typically recommend a higher deductible plan that has a lower premium. And the price is going to depend on your income and all that, because that's how all that's determined. Mm-hmm. So basically you want what we call wraparound care. So you have your primary care covered if you go with direct primary care, and then you need wraparound care. So in the event you have something come up, who's going to pay for that? So either a high deductible plan, because then you have your coverage. You already know exactly how much you're going to have to pay out of pocket, and it's not going to be any higher than that. depending on what you choose for the plan. Or a health share. So health shares cover things like that.
Is that the Zion and?
Yeah, Zion, Sedera, there's Christian Ministries, Samaritan health shares. Those are the more popular and the better reputable ones. But so those type of health shares then are specially made for those types of things. So they're made for covering more catastrophic or unexpected events or the higher ticket events.
So
now
would they
let's say
consider,
okay. Go ahead.
would they consider a simple surgery like a gallbladder or appendix? Is that a catastrophic, or where does that fall into?
That's technically catastrophic because it's not expected. So, you know, you don't expect your appendix to go bad or your gallbladder to go bad.
Yeah.
You can't anticipate it. I just put it that way. You can't anticipate it.
So any type of surgery is probably catastrophic. Even if it's a knee replacement, you would know it's coming up, correct or not?
True. Yeah. So when we say catastrophic, it basically means it's covering more of the specialty care. So whether that's hospital or specialist versus your day-to-day preventive care, primary care, things like that.
Mm-hmm. Okay. Yeah. And what were you going to say? Sorry.
I forgot what I was going to say now. It'll come back to me.
It's a wraparound. It's a wraparound. That's where you left it at. So basically, I just have regular, healthcare, and it's very high because of my age. So if I went with you, which I would like to, I would just have to get a wraparound. That.
Right. So you'd have to look at each option and then kind of financially see, okay, so the way that I usually look at it is on a yearly cost. So if I get this insurance plan and it's a horrible year, what's the amount that I'm going to pay, including my premiums and everything for the entire year? Or, if I got, the health share, how much would I pay the entire year? So, and for my husband and I to decide, we just went through this the other day again, since it's open enrollment, is we sat down and thought about, okay, what's going to be our cost this year? Okay, I know I need a rheumatologist. I need, I might need a few generic meds. GoodRx is good for that. I kind of listed out what we want covered and then kind of determine, okay, which covers what and how am I saving money? And at least for us, it came out being the health share still being better because the cost for even a high deductible plan was like $800 for the both of us. That's something I could put in our savings account.
Okay, good to look at.
Good. Any other questions?
This is Rochelle. I've got a question.
Okay.
Want to unmute? It's kind of a twofold. One, I was actually very interested to hear. I've heard the term direct primary care, but I didn't really understand how it worked. And I am thinking in terms of, I work at a specialist practice, and I'm thinking in terms of educating a lot of our patients would rather, in some cases, go to a specialist and skip the cost of going to a primary and a specialist. Especially during COVID, we saw a lot of them come here for some of their basic needs because they didn't want to pay out of pocket for both. Mm-hmm. So now to my question.
Yes. Uh-oh, it cut out. Oh, it sounded like it was going to be a good question.
Wow.
To share some of this information to our patients who
you got cut off. Go back to your question.
Uh-oh, can you hear me?
Yes, now we can hear you.
Okay, I'm wondering, how can we share some of this information to our patients that often have to choose between the cost of I need to go to my primary in order to get the referral to see my specialist, but they can't afford that. So how can I get the information about the direct primary care concept out a little bit more?
Yeah, so I am recording this, so I will post it at some point. Hopefully, it's recording. Um,
Yeah, it is.
and it is okay, good.
Yes, I see
So
there.
I will post it on our website if they want to hear a little bit more. Back in January, I did another video just on direct primary care and kind of the ins and out of that. Our website explains a lot too, and I have our videos posted on our website. So it's velezfamilyhealth.com. There's a few kind of nationwide. So direct primary care has become basically a grassroots movement across the United States. Primary, especially with primary care doctors, we've kind of all bonded together with how crazy this is. So there's a few national organizations. One is DPC Frontier, and the other is DPC Alliance. And they have a lot of information on their websites, and they also have mappers. So you could actually go on there and look at a map and find a direct primary care practice in your area.
Okay, great. Thank you.
You're welcome. Anybody else?
Well, I don't have a question, but I did want to share with everyone. Tanya and I have been friends for years, and her knowledge on this concept is incredible. Put a lot of time and effort into it. So I'm a believer in the concept of it all. I also want to share with you that she takes special time to make sure that you are aware of any potential savings. So where she showed you that $5, that was great. But she also can share information like, for example, I needed some blood pressure medication, and it's a specific one. It's because I'm spoiled and I want this one drug. That's all that I want. But it contains 3 different medications in it. And so to be on the less expensive side, or the easier side, I should say, people would say, well, just take all 3 of them, just take those 3 different pills. But again, I'm spoiled. I want it all in one. But in order to get the all in one, it's expensive. And she showed me a little trick that I was unaware of all these years, and it's through Costco. So I don't know if you know, but I just want to share that you don't have to have a membership with Costco in order to use their pharmacy. I never knew that.
Yeah.
And Costco will even accept the GoodRx script. So this one drug that I used to pay out of pocket, like, I don't know, it was roughly about $150 at the best, on the best day to get this drug. When I went to Costco, that immediately changed for the same drug to $36. And that's substantive when it comes to people's budgets. They've gone up on the price a little bit, but who cares? It's far better than the $150 I used to pay. So that is how she works across the board. So just, keep that in mind as a consideration for my little buddy over here.
Yeah. I do have a question. When is the term over for resubmitting for
Open enrollment?
Yes, open enrollment.
So they actually extended it. So if you would like coverage by January 1st, you have to sign up for insurance by December 15th.
Okay.
In order to start February 1st, then by January 15th. So it got extended to January 15th.
Okay.
It just depends on when you want to start.
Okay.
Hey, Dr. Velez, this is Johnny Walker. I
Hey, Johnny.
I just came from the gym, so I don't want you to see me. I'll scare you. But a couple of things. How regularly should I schedule an appointment throughout the year with you? And then second question, the open enrollment from my employer closed, I think, Friday. So what does that really mean when it says that the open enrollment is closed? Does that mean throughout the next year until next open enrollment again, that I'm stuck with the insurance provider that I have?
Yeah, especially with employers, they have a specific time period where they do open enrollment. With the marketplace, they have special exceptions. So if there's a life-changing event, like you were to lose a job, or your income significantly changed, or you had a baby or something like that, then they'll let you um, uh, change things or add things during that special enrollment. But yeah, usually it's kind of, especially with employer plans, it's kind of you either you're in the window or you're not, unfortunately. But again, it's, I'm not trying to say that having insurance is bad, because like we mentioned before, for especially for those emergencies and those unexpected things, or if you're seeing a lot of specialists and whatnot, having insurance is going to be helpful. Um, the trick is to know when to use your insurance. Um, so, good example for that. I had a lady that fell and injured her shoulder. Um, she has insurance. However, insurance requires me to do an x-ray of that shoulder, do 6 to 8 weeks of physical therapy before they will cover an MRI. She fell now, she's in pain now. So we bypassed the insurance, got her in the same week to get that MRI, and it was $300 for the MRI. I figured out what was wrong with her shoulder, put an injection into it. 2 weeks later, she was feeling better. So it's more about the knowledge and kind of strategizing when you're going to use your insurance and when you're not.
No, and I agree, and I like your philosophy. It's just that not paying attention to a lot of the options that insurance companies offer, like with which I'm happy with my insurance, Blue Cross, Florida Blue Cross, first care, first, what is it? Health, whatever it is. But it's 100% coverage of chiropractic and adjustment. So that's important for me because of football injuries and arthritic back. So having that adjustment at no cost. But then I'm seeing other plans have free gym memberships, on and on and on. And
now
that's
remember that free word. That's how they catch you.
Right. Well, I'm just
Nothing
saying.
in life is free.
Well,
you're paying for that and then some.
Well, no, you're right. But at least I can join the gym without paying, using the insurance that I'm already paying for rather than coming out for it. Right.
Yeah. And to answer your first question, as far as how often you're supposed to be seeing me, so that's going to depend on the person. But I like to see my people at minimum every 3 months. But obviously, like I mentioned before, members have my cell phone. They could text me whenever they have questions. They could email me. And, some people I see every month because they like to sit and chat. So we do that. Or go over nutrition or whatever. But at least every 3 months is typically what I recommend. Just kind of touch base.
Sounds good. Thanks.
You're welcome. Anybody else? It's pretty quiet, so I think we're done. Going once, going twice. No? Okay.
Okay, last question. I know.
Go ahead, Johnny.
In your experience, as we grow older, I'm reading different articles about metabolism and how it works. Do you have any opinion on aging and metabolism and just general thoughts on it?
So that's getting a little more specific, but yes. To kind of keep it simple, unfortunately, as we age, our metabolism ages too. So the best thing to do is to keep it, keep supporting it with healthy lifestyle. You know, keeping up the exercise, the physical, I hate the word exercise, the physical activity, you know, the nutrition and all that bit. But unfortunately, yeah, so age kind of works against us a little bit, but we could definitely slow it down. And we could, you know, prevent a lot of the issues. So the analogy I always use is your car. So as long as you keep your car, you know, change that oil every 3 months, you know, keep everything maintained, your car is going to last you for a long time. So it's the same thing with your body. If you take care of it, it's going to last you for longer. Things are going to break, things are going to need repair, but it's going to last you a long time.
Good answer. Thank you.
You're welcome. I think you're just testing me now, Johnny.
Have to let the folks know how good you are.
Oh.
Cheers.
All right. And any other test here? Okay, cool. So I really appreciate all of you joining us. I did record it, so once I edit out some of the beginning parts while I was waiting for everyone, I'll put it on the website. So if you want to share it with anybody, you can. Our website again, velezfamilyhealth.com.